So hopefully everybody can hear okay. I'm speaking to you from Halifax in Nova Scotia. We all weathered the storm pretty well. Bit of power outage, but it wasn't as bad as was anticipated, thankfully. So the topic I was asked to talk to you about today is reducing risk factors, lifestyle change, and why I find this a really relevant topic, especially for those of us who are so focused in geriatric psychiatry, is that medicine generally pulls us toward end stage disease, toward the extreme stages of frailty, end stages of dementia care, and so on. And it's very easy for us to become so absorbed in that very important work that it's hard to even consider this aspect of prevention or lifestyle change. But it's now a growing, I think, hot topic within medicine generally, and certainly within our field. Those of you who may be familiar with some of the work out of CABI or Center for Aging and Brain Health Innovation, there's a new public awareness campaign called Defy Dementia, which is really about raising public awareness about lifestyle changes that will reduce risk factors for dementia. And I think it also just has a sort of self-referential quality that all of us working in the field, working in healthcare generally through the pandemic, et cetera, that our own self-care, our own health risk factors, and what we can do to mitigate those has become, I think, an increasingly important topic. And then there's those who are around the very frail patient, the family members, and also the others involved in the healthcare delivery, those in long-term care. All of those are really part of the community of practice that we are attempting to serve. And so I think that's sort of just to give that kind of context for this topic. These are my disclosure slides. There's no financial support related to this program, that I'm not receiving any in-kind support. And the program is based on evidence-based practice. The objectives are to review the relevance of reducing risk factors. I've sort of touched on some of that context. To suggest an evidence-based approach to behavior change, and to also to let you know about some practical resources that you can access that are out there right now for patients, but also for all of us who are frontline healthcare providers, that we can become a bit more aware of an evidence-based approach to this that can help us feel more competent. So anyone ever heard me talk before will may have seen me quote Ben Franklin on this point, that the ounce of prevention being worth a pound of cure is now coming home in terms of the volume of the scientific evidence to suggest that this was very much the case. And when you can, think about this in terms of the prevalence of chronic disease, we hear a lot about the burden of disease as people age and what it represents in terms of overall population aging in our country. That 3 in 4 of us are inactive. 1 in 4 are obese. 1 in 4 have diabetes in over 65, and many reporting loneliness. And this has been, of course, much worse in the context of COVID. And even now, post the worst of COVID, there's still a lot of, disruption in people's attachments and social circles and so on. So here's a poll question to engage you all. The question is, what percentage of chronic disease overall would you say is accounted for by unhealthy lifestyle? And you get to choose between 25%, 50%, 75%, or 85%. Okay, we have everybody has answered, so I think I'm going to be able to share that result with you. About half of you have reported about 75%. So you're sharing, somebody else is sharing that. I think, have you been able to see the results, everyone? Yes, thumbs up, thank you. I'm a co-host, so there's a lot of things popping up for me. Everybody who's entering the room, etc. Okay. Oh, sorry. So these were supposed to also be put up for you. And when we talk about lifestyle, we're talking about things that will curb chronic disease that include exercise and sleep, healthy eating, social connection, and stress management. The answer, although the majority of you thought 75%, is actually 85%. When you think about overall chronic disease. And a more conservative estimate would be like 50% of what makes us healthy is based on health behaviors. This is coming out of a Boston, New England Institute, that about 50% of what makes us healthy is just our health behaviors. Another 20% they estimate is environment. And so this is asking that same question in a different way, as opposed to what's contributed to in terms of the diseases. This is more framed in terms of what keeps us healthy. But either way, when we look at what we spend on healthy behaviors and behavior change, it's very, very small within the formal health care system, estimated to be about 4%, because the vast majority there in red is about the interventions after disease has already occurred. So the higher intensity tertiary care costs are obviously the major contributions to overall healthcare spending. So in that, you can see the pathological model of medicine and of so-called healthcare. It's really disease care, and that's what we're focused on. But since, as I was saying, a lot of literature has come out, and particularly for us thinking about dementia and what might be preventable, there's the Lancet report came out with 2 different waves of evidence regarding preventable lifestyle factors and other kinds of factors that we can intervene on, and came up with about 12 factors that account for about 40% of global dementias that could be either prevented or delayed. So this really has raised awareness, I think, in our own community about how important it is for us to, increase people's awareness of this. Something that really popped out in that study was something like hearing loss, making sure people are able to hear and see well, does a lot, because of course, if you're struggling just to process information, it takes away from our focus and concentration on what's actually happening in the here and now. And, if you don't hear it, you can't really remember it. So there are a lot of different lifestyle and other factors that were articulated in the Lancet report. The conclusion, the executive summary, is that while behavior change is difficult and some associations are not purely causal, individuals have a huge potential to reduce their dementia risk. So this is a message we need to share. And I think particularly when we're looking at those anxious family members of the patient who has the dementia, and they're wondering, is this what's next for them? And there's a lot of anxiety about it. To be able to say, it's really never too early or too late in life to start to work towards dementia prevention. And that's not something we were saying in such a clear way in the past. So while the evidence clearly shows that lifestyle interventions and behavior change is the most effective first-line approach for chronic disease, the majority of physicians, I'm not so sure if that's true for all of allied health, but certainly for doctors, we aren't really following the guidelines. And we cite lack of knowledge, skill, or confidence in counseling about lifestyle interventions as the main reason. So we could maybe do a poll right now asking how confident do you feel about doing this kind of work. But any comments about that, if anyone wants to put something in chat, or we can just wait till afterwards. Say like low, medium, high confidence, that might be worth just putting in the chat. Okay. So we kind of need a way to bridge what we currently know from the literature into our practice. And so there may be some practice tools that you've come across, but it was actually the absence of practice tools that led me and others involved in a team with a nonprofit association called the Fountain of Health. The logo's up there, to work on developing behavior change tools that clinicians can use in their front line of care in a very brief intervention. And it's an example of what we're referring to as applied positive psychiatry, which is, instead of the pathology side of psychiatry, it's about the promotion of mental health, well-being, brain neuroplasticity, and helping people to kind of tap their own health potential, mental health potential across the course of a lifespan. So the Fountain of Health, just to introduce for those who don't know, is a nonprofit for KT on sharing modifiable lifestyle factors and also an approach to help support behavior change. So it promotes brain neuroplasticity by modifying key behaviors that we know promote brain health using CBT and behavioral activation techniques. And there's different resources, and I will finish my brief intro today by letting you know about some of those. It includes a behavior change toolkit, which you can get training on how to use through a course that we offer, and the course will be starting up for the fall of 2023. I'll make sure you have that information. And it runs for 5 weeks. It's an online course. And also there's patient resources, an upcoming 1-hour webinar. And for those who attend the webinar over 50, want to continue, there's a 4-week free workshop called Optimal Aging, which is all based on the same principles. So I'll make sure you have the information. It could be for colleagues in the front lines of care or family members, just sort of a self-care approach. The Fountain of Health has been very fortunate to be well supported by many other leading organizations in the country with whom we have either collaborated or conducted projects together with. And I'll just highlight, you'll see there at the bottom, the Canadian Coalition for Seniors Mental Health has been an enormous supporter, as well as the Canadian Academy of Geriatric Psychiatry. As a result of these associations and the projects we have conducted, the Mental Health Commission of Canada has included the Fountain of Health in these approaches, and I'm going to share with you in the guidelines for best compendium of good practices for improving seniors' mental health in Canada. So we're delighted that the same initiative that sort of inspired the Fountain of Health is also now sharing the materials with clinicians across the country. So just very briefly, what do we mean by behavior activation? So this is language that sort of I'm very used to as a cognitive behavioral therapist and a geriatric psychiatrist, but not necessarily clear for everybody. But essentially, the idea is that there's a relationship between our thoughts, our feelings, and our behaviors. And one of the best way of changing our thoughts is through our experience. And so if we can shift what we're doing, meet some kind of goal that we've set for ourselves, then we end up talking to ourselves in a more positive way. Or if we're not able to meet those goals, we can still talk to ourselves in a supportive way that allows us not to be completely off the hook, but rather to continue to persist in the face of setbacks. And so if we can just help people to shift their behaviors, then it leads to more positive thinking and also mood states and overall improved well-being. So it comes down to this model of these interrelationship between thoughts, feelings, and behaviors. And you get an example. Let's say I activate myself by getting out for some more walks, which I've been meaning to do, but I finally get around to do. Then while I'm out for my walk, I might have some positive thoughts about that I care about myself and my health, and I can fit this activity in. And then this can improve my well-being or lower my anxiety or help me get a better sleep at night, for example. So you can either start by, positive thinking, or you can try just shifting your behavior, and then you get this two-way interrelationship. So in the course that I will talk about at the end, there's an approach to use that the Fountain of Health has developed, and it's really just a way of packaging the current science into a short and simple model. I refer to this as the Thrive approach to well-being, and it's based on positive psychology's Martin Seligman's well-being model called the PERMA model. That's an acronym for a lot of the same domains. But in addition to that, we have health habits, which really comes down to physical activity, nutrition, things that are not in the positive psychology model. And it includes a behavioral activation approach, which is also missing from the PERMA model. So it's a little more useful for healthcare providers. So the Thrive obviously stands for the word thrive, which means to be able to meet your goals in spite of difficulties like being busy or having someone who's sick that you're caring for, or et cetera. It also stands for this acronym, T for thoughts, H for health habits, R for relationships, I for interests, E for emotions, and the V, which I skipped, was for valued goals. And the idea here is the approach includes not just these domains, but also a three-step sort of model where in step one, you think about assessing yourself in these 5 domains, in the key action areas. How am I doing overall in terms of my health habits? And in any behavioral activation, you need to get that self-reflection first before you set the goal. In step 2, we think about, okay, I wanted to increase my physical activity. That's a common one, right? Instead of, well, what should I do? What ought I do? We can think about what would I value doing? What would mean something to me? So it's very individualized. And it also needs to be specific and measurable and those kinds of things that allows it to be doable. And then the third, which we often forget to do, and sort of the hardest one in a way, is tracking your progress. So, it seems a bit tedious, the idea of actually writing it down and seeing whether you do it or not. And what's even better is if you're working with a healthcare provider, you can then have someone to tell how it went, whether it went well or not, regardless, and someone who's going to be in your corner. And that's the role that we as healthcare providers can have vis-a-vis anybody else that we're working with. And it's also the part that we can drop the ball on because we too can get discouraged or not really feel like we know how best to help people when they haven't met the goal, that has been set. So we can be a bit avoidant of that piece and therefore lose track of this with the patient. So I mentioned about setting a very specific goal. So specifically, what concrete steps will you take? The acronym SMART helps you remember these. Meaningful, why does it matter? Measurable, how will I know I've done it? Action-oriented, realistic, what's doable in the next month, given that I didn't go to the gym for the last 10 years? That kind of thing. And time limited. So when will I do this? I'm going to walk for 5 minutes. I'm going to do that on Saturday mornings because that's the only chance I'm going to get. And then that becomes my, once a week, 5-minute behavioral activation. So I gave that example of such a small goal, but in fact, that is what we're looking for, is the micro goal. And that's again where we can fall down as clinicians. We're used to big ambitious goals ourselves. So the idea of the small micro goal can get lost on us. So here are some brain challenge, social activity. Might be call a friend or family member to chat once a week for a month. So these sound really, really small and insignificant, but when they are done with this intentionality and with the tracking, then something interesting happens. What happens is actually we adhere to the goal. So if it's actually doable and it's being tracked, we monitor and discover, actually, I was able to do that. And that's the key to success. So when we actually achieve a goal that has an intentionality behind it, we're self-aware that this is something we're doing for a particular reason. that adherence leads to self-efficacy and more positive self-talk. Well, maybe I could do that, or I could add to that, or maybe I can continue that. And then you get intrinsic motivation in this positive direction. And by the way, this works, this is part of a general, if you're interested in the reference by Olander, this is a general behavioral principle, and it's been incorporated into many of the sort of wellness programs across the country. The program out of Cornell called Your Way to Wellness that was adopted by our province is all based on this behavior change model. So, and what's fun is that no goal being too small is really true, that adherent, that tiny drop of water, tiny change makes this ripple effect of cognitive shifting, which then leads to increased motivation to continue along that path. So why does that matter? It's sort of the same analogy as, thinking of another example that's concrete is brushing your teeth. If you do brush your teeth every day for your entire life, chances are you'll still have them in your late life. And we haven't historically taken the same approach to promoting brain neuroplasticity, that there are certain health habits that actually make a big difference, whether it's walking a flight of stairs a day or engaging with someone socially throughout your life, or eating more salmon and omega-3. There are certain lifestyle habits that really do add up over time. And so these tiny changes make a difference to our health trajectory. So this analogy sometimes, compared to a plane, where if we can just shift that takeoff by 1 degree, we may end up in a very different country over a longer flight. So do these tools work in clinical practice? Does it actually make a difference? Together with the Canadian Coalition for Seniors Mental Health, we had the chance to share this approach with over 2,000 clinicians across the country. And of those clinicians, they engaged their patients to attempt this approach and gave them a 4-week follow-up. And we found that in over 1,500 individuals who used that approach at 4-week follow-up, 80% of the patients had at least partially achieved their health goal. And they also reported self-rated improved health attitudes and well-being at a month mark. And this has been published in several different journals, including the one there on the bottom, led by Kieran Rabaru and David Kahn and Claire Checklin and myself, called Promoting Behavior Change in Canada, Integrating Prevention and Wellness in Frontline Care. So that project with the CCSMH shared these tools that I'm showing you now with clinicians, called the Health Behavior Change Toolkit. It's a free downloadable toolkit, as well as a wellness tracker, which is web-based. We're calling it an app because you have to log in and register and you get notifications back and forth, but it's a web-based, free, usable on any device app, as well as clinician education. We have this short video that's linked here. And then the legacy of this project really was to develop the 5-week CME accredited course so that we could continue to train people in this model. And these are the results I was just mentioning. We had over 2,000 clinicians who received a 30-minute to 60-minute training session. Of those, a third, 700, wanted to use it, the toolkit, in their practice. And then when they went on to use that with their patients, and those who returned their materials to us reported, well, let's see. Oh, sorry. So I just put the results bigger on the left since the infographic's a little hard to decipher, but you'll see that whether they used the paper-based tools or the wellness app, it was between 80 to 85% of people reported improved well-being. About 90% reported at least partially achieving their goal, and the majority were in physical activity, although there was representation across all the different domains. So these are the papers that I mentioned. And then I also said you can access this kind of training for your patients and for clients as well. So this is a 4-week community-based workshop series. It was initially delivered here in Nova Scotia by retired physicians through Doctors Nova Scotia, our medical association. And this was a project led by a resident, Dr. Amy Goff. You'll see her name there at the top. And it was presented at the CAGP meeting at one of our annual scientific meetings. And what she found is that in offering a 4-week behavior activation training program in a group setting to people 50 and up led to significant improvements, the same kind of behavior change that we saw with somewhat better outcomes in terms of goal adherence and improvements in motivation to continue afterwards. So in order to share some of these approaches more widely, the Fountain of Health has developed a Thrive Learning Center to make sure that the various target groups can come to the website and find what they are looking for. So you'll see this on the website, materials for individuals, for organizations, and for clinicians like us. And you can click on there to find more resources within the website. And anyone can use the free wellness tracker. And we've recently had a partnership with Wellness Together Canada to share these materials more widely. So that's just included there. This QR code on the bottom right of this poster will let you know about the upcoming public webinar. So this is coming up on Friday, October 13th from 12 to 1. This is, again, more toward the public audience. And it's a 1-hour webinar to introduce people to some of these concepts, as well as to become aware of the 4-week optimal aging workshop. So if you have people that you would like to see go through the workshop, they could come to this intro webinar first and hear about it, and then they could decide whether to register. So if you want to encourage them to do that, again, this is in collaboration with Wellness Together Canada, and it's also offered in French. So anybody in French-speaking Canada who have French-speaking patients or family members can have the entire program offered to them in French. So once people have received the 1-hour webinar, they're welcome to come to the 4-week workshop. And then after the 4 weeks, they can have an additional, what we call booster in cognitive behavior therapy language, that's sort of like keeping it going. And so there's an extra session included in this free program for the public. Finally, I know that we have a case to talk about, but I promised to tell you about the opportunity for the accredited course. There is a fee for it because of CME accreditation. Physicians, of course, are invited, but any allied health workers who would like to do the course are welcome. So this is just some of the comments from course graduates. It is very, very practical, applied approach. You get to learn how to use this approach for your own self, and also try practicing it with 1 or 2 people, can be family members or clients. So there's a URL there, and I think it was sent out in a poster as well. And of course, this is the more detailed in terms of learning objectives for this course. So it starts October 11th, and registration should be received by October 4th. So there's still a few weeks left to sign up for this. The course is done virtually, and the lectures are recorded. So you can watch it on your own. Although there's like a little caveat on that. For CME accreditation, you have to come to these sessions in real time, but you're welcome to attend and just audit the course as well. So there's a QR code there, and anyone who wants more info, you're welcome to do that. So that's it for my portion. I'm happy to take questions, and can also just open it up for the case.
Wonderful. Thank you so much, Carrie Lee. Really appreciate all this terrific information.